I'm Dr. Sujal Mandavia, Chief Medical Officer at Carbon Health. As an employer in California, you may be concerned about how to stay in compliance given the changing landscape. Today, we're going to review OSHA requirements and tips for keeping your employees safe. We'll review what actions every employer should take regardless of an outbreak or exposure. First, employers are required to provide training to employees about the basics of COVID-19, including common symptoms, the importance of social distancing, masks and hand washing, not coming into work when sick, and the benefits they're entitled to under state and federal law. Second, employers need to assist with physical distancing at work. Third, employers should identify and correct hazards. These can include interactions, activities, equipment, and materials that could potentially expose employees. This may even require reviewing the ventilation system. Next, employers should have a written plan. This plan should inform employees on how to report positive cases, how the employer will comply with the rules, and when testing is mandated. Having any COVID-19 exposure in your workplace can be scary. In that situation, there are 5 key steps to follow. Step 1, make sure you have a process in place to know of any exposure. A licensed healthcare provider or a local health agency may inform you, or alternatively, the employer or their emergency contact may inform you. Be sure to keep records of all known or suspected COVID-19 cases. Step 2, investigate the COVID-19 case so that you determine when there was an exposure and who might have been exposed. Step 3, give written notice of potential exposure to all employees and contractors who were present at the same work site within 1 day of learning of the COVID-19 case. It's critical to give notice in a way that does not reveal the identity of the individual. You will also want to give notice of any COVID-19 cases to your workers' compensation carrier, as well as the employee's union, if the employee is part of a collective bargaining agreement. The secondary notice does not have to be done within 1 day, but we recommend notifying as soon as possible. Step 4, offer testing to potentially exposed employees at no cost and during working hours. Step 5, do not permit the employee who is tested positive for COVID-19 to return to work until return to work requirements are met. Requirements will depend on whether the employee was symptomatic or asymptomatic. You should not require a negative test before permitting the employee to return to work. You should pay employees throughout these quarantines. There are additional requirements if you have an outbreak at your site. An outbreak is defined as 3 or more employees reporting COVID-19 within a 14-day period. A serious outbreak is 20 or more employees with COVID-19 within 30 days. If you have an outbreak, you also need to give notice to the local public health agency within 48 hours and provide periodic COVID-19 testing to all employees in an exposed workplace during an outbreak. Please refer to the California OSHA website for more information on implementing COVID-19 procedures.